All right, if you can go ahead and introduce yourself, and then we'll get started. And actually, we'll go ahead and get started. So I'm going to stop sharing so that Dahlia can share. And I'm going to drop in the chat one more time. Please leave your name, your position, your organization, and if you could have unlimited anything, what would that be? All right, so, oh, my camera is off. And let's see, are we recording? We are recording. Okay, so welcome everyone. Thank you so much for being with us here today for the community stakeholder meeting today, which is August the 17th. Dolly, if you can go to the next slide, please. All right, and the next slide, please. All right, so we're going to go through welcome introductions and then our two presenters, and then we're going to wrap up. Make sure we share any announcements that are ahead, and then we'll close out. So again, thank you for being here today. We have this meeting every other month, just as an opportunity to share information from our agency and our sister agencies and our valued partners about important topics that are coming up. And today is all about the state-based exchange. And we have excellent presenters here today. They're going to share all the information necessary and then take any questions, or at the very least take back some probing questions, just to make sure they continue to consider what our stakeholders and partners may need in the community. All right, so one last time I'm going to drop, if you can drop your name, position, and organization, as well as answer if you can have unlimited anything, what would that be? And let me see, do we have an introduction slide next, Dahlia? Let's see. I can't remember. If not, then I'll go through it. Yep. Okay, so what we will do, let me go through and see. Now, for me, I will tell you, if I could have unlimited anything at work, it would be unlimited PTO or unlimited leave time. I always want to go off somewhere to do something. And I think if you're extremely productive, you should be able to have extra dates. So that would be what I would say. Let's see, who else do we have here? Unlimited funding. Misty said unlimited funding. And then Linda said more time to talk with valued partners. I think we all run a little short on that, particularly when you're dealing with such hectic work weeks at times. And then Meredith said unlimited budgeting for outreach and community partnerships. Now that will be an excellent opportunity to do some really innovative work. And let's see, who else? Rachel said unlimited resources for enhancing print materials and Diet Coke. Now, I don't know about the Diet Coke part, but the unlimited printing materials, I'm also down for. I think that's great. Unlimited flexibility from Mora. And let's see. Susan says unlimited appreciation for supply. Hold on, let me see. Unlimited supply of lead abatement contractors. There must be a shortage on those. And considering what lead can do to the human body, I would think that would be extremely important. I'll say, let's see, unlimited funding for programs and services, and unlimited coffee. Kristen said unlimited coffee. I don't know. I heard yesterday that if you have unlimited coffee, it could affect your sleep. So I don't know about that, Kristen. I think we all need probably some limitations on that. And then last but not least, unlimited dental providers. I completely agree with that. We definitely don't have enough. I'll keep scrolling through and maybe I'll bring up some more towards the end. But so let's go ahead and get started. Next slide. All right. So first up is Holly Murlock. She's the Deputy Director of External Affairs and Policy at the State Corporation Commission, and she is knee-deep in all things state-based exchange. I know she is extremely busy considering this kicks off this fall, so I'm going to turn it over to her. Welcome, Holly, and thanks for being with us today. Ooh. Holly, we can't hear you. I'm going to see if I can.
Okay, can you hear me now?
Yes, we can hear you now. Perfect.
Wonderful. Okay, great. All right, so well, thank you, Natalie, and thank you to the DMAS team for the invitation to present here today and to meet with all of you, and thank you to everyone who's on the line for spending some time with us today to hear all about Virginia's new health benefit exchange. I'm very excited to be here. As Natalie had mentioned, we are launching this fall on November 1st. So this is just a great time to get out in the community and to share some updates on the exchange and what that will look like for Virginia. So today I plan just a very high-level overview, but certainly would be happy to hear your questions and comments and take those back with me to the exchange. So first of all, just a very high level. So the exchange was incepted in 2020 in legislation, and the General Assembly gave us some statutory duties. And the first of those was to transition Virginia from healthcare.gov to a Virginia-based marketplace. And the second duty, which we all take it all extremely seriously, but of course this is one of our most important, is to better coordinate with Virginia agencies to support health insurance continuity across insurance coverage programs. So that's one of the reasons that we're very excited to be here with you today. And then of course, in the service of all of that, working to reduce the number of uninsured. Okay, next slide. Okay, so just a little bit of a transition update. So on September 29th of 2022, it's hard to believe that was a year ago, we awarded a 9-year contract to get insured for Virginia's platform and consumer assistance center. And so that contract serves as the foundation for the state-based health insurance marketplace that we are operating in Virginia for Virginians. And you'll hear a little bit more of that theme throughout my presentation. Get Insured operates in 7, but now I will say 8 of the 18 state-based exchanges, 8 of the 19 state-based exchanges nationwide. And they have a lot of experience in this space of transitioning states from the federal platform to their own state-based marketplaces. And so they have done transitions in Nevada, New Jersey, and Pennsylvania as well. Those are the most recently transitioned states in the last several years. So our platform and consumer assistance center will be integrated and will be staffed by customer service representatives that are dedicated to Virginia. So what is Virginia's insurance marketplace? So the Virginia's marketplace fully replaces healthcare.gov for Virginia. And it will, so all of the services, the way that people shop on healthcare.gov today will just be replicated here on Virginia's marketplace and adapted for Virginia. It will provide health plan shopping and enrollment services for individuals and families. And the eligibility for marketplace coverage will follow what is currently in existence on the FFM, except that a person would need to, of course, reside in Virginia, be a U.S. citizen, U.S. national, or lawfully present immigrant for the entire time they plan to have coverage, not be incarcerated unless they're pending disposition of charges, and be uninsured or generally not eligible for Medicaid or Medicare, and not have an offer of affordable employer-based coverage. Next slide. Okay, so what will we do? So Virginia's marketplace is going to determine eligibility for, so MAGI eligibility for Medicaid. Virginia will remain a determination state. And then also, of course, for FAMOUS coverage. We'll determine eligibility for coverage in Virginia's marketplace plans and financial assistance programs, including advance payments of the premium tax credit towards monthly premiums, cost-sharing reductions to lower what consumers pay for out-of-pocket costs like deductibles, co-payments, and co-insurance. And also, so cost-sharing reductions, of course, would apply to individuals with incomes between 100 and 250% of the federal poverty level, be eligible for premium tax credits, and enroll in a silver plan through the marketplace. Next slide. Okay, so this is just to give you a little indication of at what income levels people begin to qualify for premium tax credits. So I said, generally speaking, an individual would qualify for PTCs with an annual income above $20,120. And that's because Medicaid, so MAGI Medicaid goes up to 138%. But if you don't qualify for Medicaid, you could qualify for premium tax credits beginning at 100%. So, but just wanted to emphasize, so that generally speaking, it's usually about 138% or just above And a family of 4 would qualify for premium tax credits with an annual income above $41,400. Next slide. So what is covered? So on the exchange, qualified health plans are required to cover 10 essential health benefits that include ambulatory patient services, emergency services, hospitalization, pregnancy, maternity, and newborn care, mental health and substance use disorder services, prescription drugs, rehabilitative services and habilitative services and devices, laboratory services, preventive and wellness services, and pediatric services, which includes oral and vision care. And also, it's worth mentioning that qualified health plans also offer key consumer protections. So that is, there's no coverage denials for pre-existing conditions for essential health benefits. Individuals are able to receive free preventive care services. There are no annual or lifetime limits of essential health benefits, and children can stay on their parents' plans until age 26. Next slide. Okay, so plans in the marketplace are categorized by metal levels. And so generally speaking, there are bronze, silver, gold, and platinum categories. And they are based on how you and your insurance plan split the costs of that coverage. The categories themselves actually have nothing to do with the quality of care. And for each plan category, an individual would pay a different percentage of total yearly costs for their care. So if an individual chose a bronze plan, they would have, that's an actuarial value of 60%. So consumers would pay an average of 40% of the cost on average. For silver plans, that goes up to 70 and 30. For gold, an average of 80 and 20, and platinum, 90 and 10. And catastrophic plans are plans that have limited eligibility. They are eligible to individuals who are under age 30, or individuals who need a hardship exemption, which is provided by the federal government. Okay, so when can consumers enroll in coverage? So generally speaking, there are 3 times when people could enroll in coverage. And the first, of course, is the annual open enrollment period. This is mirroring the federally facilitated marketplace. So we are sticking with the November 1st through January 15th time period. There are also special enrollment periods that marketplaces can adopt to allow consumers to purchase a marketplace plan or make changes after the open enrollment deadline. As our state-based marketplace, of course, we would be able to identify additional special enrollment periods, if a situation were necessary. One that may be important to all of you is that we will be actually continuing the federal unwinding SEP through January 31st, 2024. And the other category of time when people can enroll in coverage is when the consumer experiences qualifying life events. So consumers outside of open enrollment or a special enrollment period, consumers must experience a qualifying life event to be eligible for an individual SEP. And examples of that include, but are certainly not limited to, there's a much bigger list. So if a consumer loses a loss of minimum essential coverage, such as coverage with their employer or with Medicaid, in the instance of marriage or divorce, childbirth or adoption, or if they have moved outside of their plan service area. Next slide. Okay. So this is just a snapshot of plan year 2023, which shows you sort of what coverage looks like in Virginia. And so this year, there were 12 insurers that offered individual and family plans in Virginia. That is a great number. There were also 8 dental carriers. And this map sort of demonstrates sort of where those carriers are providing, where they are offering plans. Plan year 2023 was the first year since 2010 that consumers had the choice of more than one carrier in every county. And that is just really a tremendous achievement. This year, there were, at the end of open enrollment, there were 346,140 Virginians who had enrolled in private individual market plans. That's an increase of almost 40,000 over 2022, and it has been Virginia's highest enrollment since 2018. Next slide. Okay, so how will consumers apply for coverage in Virginia? So when we transition to our marketplace, we will have our website available starting in October. And so this will be also translated into Spanish, and the URL is marketplace.virginia.gov. That is not up yet, but it will be in October, and we will be doing a launch and making sure everyone has access to that information. They will also be able to call our Consumer Assistance Center, and there will be language assistance available through interpreters. There are also, of course, our Marketplace Enrollment Assisters and Navigator programs through Enroll Virginia and Boat People SOS. And we also have Marketplace registered agents who are able to help individuals with applications, eligibility, and enrollment. Next slide. So just a little bit more detail about our exchange assisters. So for plan year 2023, we have two Navigator program grantees, and that is Enroll Virginia through Virginia Poverty Law Center. I know Deepak is here, and he'll be talking with you a lot more about that program. And we also, they are statewide, and also Boat People SOS that primarily serves Northern Virginia. So navigators are trained and certified individuals who offer a broad range of support to people who need to obtain their own health insurance. Their services are free and include unbiased information regarding insurance options and assistance with applications for programs like Medicaid, FAMUS, premium tax credits, and cost sharing reductions. And there are also insurance agents. There are just under 4,000 insurance agents that are registered to help individuals obtain coverage in Virginia. They must be licensed by the Bureau of Insurance and certified by the exchange. They provide free and personalized assistance, and they can also make recommendations for health plans based on an individual's consumer information. Next slide. Okay, other types of exchange assisters, so there are certified designated organizations, and these are organizations that oversee certified application counselors who are individuals who are trained and able to help consumers seeking coverage. They have to be designated by the exchange to operate in Virginia, and CDOs that are designated by the exchange do the process of certifying certified application counselors. And those are individuals who are staff members or volunteers who are certified and trained to help consumers look for coverage options through the exchange and Virginia's Medicaid program. They can help consumers complete the eligibility and enrollment process, and their services are also free and unbiased. So one of the key principles of our exchange is really that we are working to build a health benefit exchange that is for Virginia, by Virginians. And we have made substantial investments in our stakeholder engagement program to make sure that we are, one, sort of doing the operational preparation. We've done many, many months of comprehensive preparation with our carriers and our agents, and also providing very frequent opportunities to engage with you in things like town hall meetings, one-on-one weekly onboarding sessions with the carriers. We've provided platform demonstrations and weekly email updates and FAQs to make sure that, one, we are being, we are sharing all of the most recent updates and individuals know what's happening and when, but also to get really critical feedback from all of our stakeholder partners and incorporate into our planning and our program for the exchange. We have just had a tremendous amount of engagement from our carriers, agents, and navigators, and our partner agencies, and so we are, this is all helping to shape the program of the exchange, and we are really invested in maintaining this ongoing work through our operations, as we continue to operate as a state-based exchange. So just wanted to share this slide because it shows you just a little bit of the efforts that we are making in order to make sure that we're providing everyone with adequate information and getting critical feedback from our partner community. Next slide. Okay, so if you have any questions and want to reach out to us, here is my email on this slide. It's holly.mortlock@sbc.virginia.gov. And listening on the line with me today is also Kendra Weindling, who is our Stakeholder Engagement Manager. You can feel free to reach out to Kendra with any questions as well, and we will get back to you as soon as possible. So thank you so much for listening and for the opportunity to be here.
Thank you so much, Holly. I'm like, what a breath of, also it's exciting, first and foremost, to have this coming our way, and then to hear all the different things and wonderful things that are happening within this project in anticipation of this becoming a part of the continuum of opportunity that our members have is awesome. So we're going to continue on with Deepak today, and Holly alluded to him today. He's going to be talking about a wonderful partnership and opportunity for us. He's the director of the Center of Healthy Communities and Enroll Virginia at the Virginia Poverty Law Center. I'm sure that he has lots of great resources to share, particularly in his people capacity, because they do a wonderful job there. So welcome, Deepak, and thank you so much for joining us today.
Yeah, thank you so much, Natalie, and really happy to be here and really excited to follow Holly with that presentation talking about our new state-based exchange website. So yeah, my name is Deepak Mandala, and I'm director of the Enroll Virginia project. I'm at the Virginia Poverty Law Center. Maybe next slide, please. Yeah, so just a little bit about Enroll Virginia ourselves. So we actually launched about 10 years ago now, and it was just in response to the launch of healthcare.gov at that time. And as we all remember, if some of you were around then and working in health coverage, that was not the best launch. And so we kind of started our project as a response to that, to help Virginians just navigate all of the things that are going on with health coverage. Because even in health coverage itself is complicated. People are hesitant to access it and use it because they're often, it's a scary topic to think about. And, despite the fact that, we're in a good place in Virginia now, we have a lot of great options. We have, expanded Medicaid coverage. We have a new marketplace that's going to be launched here with a lot of really good plan options and affordable options with expanded tax credits. But navigating that can be very complicated and scary for a lot of people because sometimes they've tried it before and just we're not successful in that. So our project was launched, and we've been statewide in communities just helping people both navigate the process and apply for various programs, but also just learn about the various options and how they can apply. Next slide, please. So I'll just kind of expand on that. I know Holly talked a little bit about kind of how navigators fit into the marketplace itself. And that's something important to just to remember that the Virginia marketplace itself is more than just the website. The Virginia marketplace is really a great thing for us because it's a really broad-based program that helps Virginians access health coverage in a lot of different ways. They're going to be able to access it through a new website. They're going to be able to access it, through a call center that's dedicated to Virginia. But then also we're going to have, in-person assistance throughout Virginia. And so the state-based exchange does fund us to provide that in-person assistance in communities to sit down with people and just walk them through what is the marketplace, how to access the marketplace, how to access their accounts, how to set up accounts, but then also, just seeing what the plan options are. And, one of the really great things in the last 3-4 years has just been in some places, really an explosion of plan options. Holly mentioned that, for the very first time, every single locality in Virginia has at least 2 carriers providing service. And in some areas like Richmond and Northern Virginia, there's upwards of 100 plus plan options to navigate through. And so, that can be overwhelming for sure. Sometimes our appointments last 3-4 sessions, multiple times going through, 100 plan options, but it's still a good thing to have more than having no options. So kind of working with Virginians to understand kind of what those options are and and the breadth of those, and then the second bullet there is helping them apply for that financial help to help pay for those plans, both the premium tax credits and then also those cost sharing reductions, which are really important to lowering the cost of the deductibles and co-pays and co-insurance. And the vast majority of people who enroll in plans through the Virginia marketplace right now at healthcare.gov do qualify for that assistance. I think it's upwards of 85% of all the enrollees do qualify for some assistance. And if they're not eligible for marketplace assistance, many then are able to get coverage through the Virginia Medicaid and FAMOUS programs. And one thing that's nice about that is that when someone applies at, currently at healthcare.gov or at the Virginia marketplace when it opens this fall, they will be assessed and in some cases determined eligible for the Medicaid program as well. So there's not that extra step of them having to then file another application on either Common Help or through Cover Virginia to apply for Medicaid. It's like a one-shot thing where if they apply at the marketplace, they're assessed eligible in many cases for the Medicaid program. Another important piece that we do is this community-based outreach and education. So we have navigators throughout Virginia just partnering, and I see many on this list of attendees here that we work closely with to both respond to needs for large enrollment events. So in some cases, I see on here some folks from rapid response. So when there's a plant closure or a business closing, we'll often coordinate with rapid response to have assisters available to both provide education about transitioning from coverage, employer-based coverage to marketplace coverage or Medicaid, and kind of other situations like that. And then the last piece is just helping with the complex cases and kind of any other post-enrollment issues. People sometimes enroll in these coverage options, but then have trouble accessing care. They're trying to find a dental provider, like I think I put in the note there, or they're trying to find a specialist. Navigators do continue to provide that type of assistance of helping clients and Virginians understand how to use the plan once they've enrolled in it. Next slide, please. I wanted to put this here too, because I want to just make sure people know that, we're not the only in-person assistance option in Virginia. Like we actually have a great network of partners that we work closely with, and these are kind of the various options. With the Virginia Navigator program, we're one of the 2 options, and we work closely with the Boat People SOS program based out of Arlington to also provide assistance, particularly up there to many of the communities that are in the Vietnamese and Spanish speaking communities and Korean communities to provide assistance in their language. We do that throughout Virginia. We do provide assistance in communities' language that they prefer, and that even includes people who might need help with accessing care through sign language or other types of disability services. Another piece on there is, I think Holly mentioned the CAC program. So we have a broad network of CACs actually located at many of the health centers throughout Virginia. And so we actually, both on Cover Virginia and on the Enroll Virginia website, there's a map that you can find where these are located. And I'll put a link to that in the next slide, I think. But another thing I wanted to put on here is there's the Virginia Healthcare Foundation has a Project Connect program that provides free enrollment assistance with Medicaid and FAMOUS. And many of those sisters are also knowledgeable about the marketplace and are able to provide referrals as needed when they're assisting clients. And then the last bullet there is just that important piece of the VICAP program that provides help with Medicare. Many of the people that we assist don't know when they're coming to us what program they're going to qualify for. They just are uninsured, or they've lost their coverage recently, and they just need help getting care. And so that's why we often will partner very closely with all of these other programs, including agents and brokers, to just help people find, get to the right place they're able to enroll in the type of plan that fits their family's budget and gets them the maximum amount of assistance that they qualify for. Next slide, please. Yep, so this is kind of showing there, that's the Enroll Virginia assistance map that we've created on our website, and this is actually also posted to the Cover Virginia website as well. And this just helps Virginians locate all of these various assisters. So all of the navigators, including from Boat People, all of the CACs, and the Project Connect assisters are all located on this map. So people can just type in their zip code or their address, and it will pull up the phone number, and in some cases, even there's a link to schedule an appointment directly through the website with those partners. If you are, you're a partner on here and you're interested in, becoming a CAC yourself, or you have assistance for Medicaid or CHIP and you're not on this map, feel free to reach out to me, and I'd be happy to include you on this map. We want to kind of keep this as as best as we can as a resource for Virginians to continue using it. Next slide, please. I just wanted to say, Enroll Virginia is kind of one and very important piece of what VPLC does as far as kind of community-based resources. I just want to put on here, we do have 4 other resources that I think are quite important for, I think, many of the people on the call. One is we run a SNAP helpline. It's a bilingual service that people can call and get help with SNAP applications and just SNAP eligibility. On the website, there's also a SNAP calculator that people can use to just see if they're eligible for SNAP benefits. We also have a predatory loan helpline, a utility helpline, and then a new one that just launched this year, a senior legal helpline as well. So just kind of have those as additional resources that we offer at VPLC. And then slide, I think. Oh, other direction. Yeah, thank you so much. Yeah, that's just our website again, and thank you so much, Natalie, for having us today, and I'm happy to answer any questions.
Thank you so much, Deepak. Well, I hear a little feedback. I don't know why. So I will say that we've already got one testament to the Enroll Virginia navigators participating in a rapid response event, and they've been absolutely wonderful in helping all team members, all of our community members. So that's been really great to hear. I don't see any other pressing questions. One of the other ones that I know that we often get is, what is the difference? And this may be a Holly question. What is the primary difference between the state-based and the federal marketplace that exists now? And what would that difference look like for members on a day-to-day basis once the state-based exchange goes live? And Holly, we can't hear you.
Okay, how about now?
Yes, we can hear you now.
Great. Well, thank you so much for that question, and that's a question we're really happy to answer. So a couple of things, actually lots of things, and Deepak touched on some of them as well. So first of all, so the services themselves are the same. So we are replacing healthcare.gov for Virginia, but what will happen is that individuals will be able to come to our website that will be completely tailored for Virginians and enroll in coverage there. As Deepak had mentioned, they will also have access to all of our Virginia-based navigators, Virginia agents, but one of the key defining things is that our marketplace itself is going to be tailored entirely to the needs of Virginians. And so, so we will also have a consumer assistance center, a call center. So currently today, when you go to healthcare.gov or when you're working on the federal marketplace and you need to call into their call center, you will be kind of in a queue with 32 other states, right, and serviced by people, you know, who may not be as familiar with the landscape of Virginia and the options here. But today, when we transition for November 1st, our call center will be entirely dedicated to serving Virginia. So the call center staff will be completely trained on Virginia's policies and procedures and better have greater familiarity with our population and the services that are available to them, and will help them get coverage. So also, because of that, we're also able to have you know, much higher customer satisfaction rates in terms of resolving complex cases, any appeals or questions that people need to have resolved coming through the call center will be resolved much more quickly than they typically are sort of on healthcare.gov today. So those are some of the key consumer-focused things that will be different. But also, I think what's one of the most important things is that we are accessible to you all here in Virginia, right? We are, you know, we will have, you know, monthly town halls with our key stakeholders. We have community meetings such as this, where we can really take the feedback that you are all providing to us, and also, you know, inform you of updates and things going on, and be able to take all of that information and incorporate that, you know, into an exchange program for Virginia. So really to be responsive to our community and build an exchange that is more reflective of the needs of Virginians. We also sort of will be able to, and I think this is really important this year especially, better able to coordinate with our partner agencies, so such as Medicaid and social services. So we will have, so, you know, as Deepak had mentioned, you know, we do have that single streamlined application where people will only have to apply once, right? So they will apply for coverage. The exchange will make a determination. If they are Medicaid eligible, we will send them to Medicaid. If they don't appear to be Medicaid eligible in terms of MAGI, but they may be eligible for Medicaid, we will also send that to Medicaid. And then also you will be able to send folks back to us as well. So in a much more streamlined fashion than happens today. So we know that, you know, having, you know, state agencies talk to the federal government sometimes in terms of transferring information can get really clunky and doesn't always work as seamlessly as we hope, but this transition will really help us do that. And so we're really excited to be able to bring that to Virginia. And of course, we're very excited for all of the great partnerships that we have had with Medicaid and social services so far, and really looking forward to that work together ongoing.
Excellent, excellent. Next slide, please, Dahlia. Another question that has come up is, will our partners need to be trained in anything different when this transition takes place? Right now, you know, when someone falls out of coverage for Medicaid, considering they've done all the appropriate steps, Medicaid will refer them to the to partners. Will that process continue? Do partners need to do anything differently in order to ensure that our members who may qualify for this coverage through the state-based exchange or even through the federal marketplace right now need to take any additional steps to make sure they're prepared to help our members or potential members?
Yeah, that's a wonderful question, Natalie. And so, yes, so that is part of the ongoing conversations that we are having with Medicaid and social services about the areas where we can provide some information and updates to folks that cover Virginia and also to the local departments of social services about what this transition will mean, and where their contact points are, and where to send folks when they need to. As far as, so, you know, when folks lose eligibility for Medicaid, starting on November 1st, we will get those account transfers because our systems are well coordinated. So they will, someone is found ineligible for Medicaid, the exchange will receive that account transfer. They don't have to do a new application. We will just be able to take that and determine if they are eligible for a qualified health plan. And then we'll be able to conduct some direct outreach to that person and say, we understand, that you have applied for Medicaid, that you are, are not eligible, but you may be eligible for a qualified health plan. We want to help you do that. And we'll also be able to see sort of at all the different places in the process. So sometimes, people find out that they are ineligible. They might have come into onto the platform and shopped for coverage, but they might not have enrolled. We would be able to reach out to that person and say, it looks like you were shopping. Just like you, so if you're shopping, online today, sometimes you'll get an email that will say, are you ready to check out? Or, do you want to take another look at this pair of shoes? It'll, of course, be much more formal and official than that, but we will be able to see where individuals are in that enrollment and shopping process, and to be able to conduct some outreach to them to help support them in choosing a qualified health plan.
Is there a direct connection from the state-based exchange with the Department of Social Services?
Yeah. So that what that reference is just through the VA CMS system, right? So that DSS operates, for Virginia Medicaid.
Okay.
Yeah, I just
did you want to jump in for any reason?
Yeah, I just want to add one more piece to that. One thing that I think is very important for everyone that's working with Medicaid members, particularly when they lose that coverage, is that it's already actually available on healthcare.gov, but it'll be continue to be supported through the new state-based exchange, is that they will be eligible for a special enrollment period. So it's kind of a special enrollment period that was created specifically for Medicaid unwinding, so that when people are losing coverage due to unwinding, they are able to enroll in a plan through the marketplace. And that'll be running, my understanding, that'll run through April of next year. So, for those clients, I think it's important for them to kind of reach out to the marketplace, whether it's now healthcare.gov or when we transition to the new one, to seek assistance there, because they can get help enrolling. And then it's also important because, when they're filling out that application, it may turn out that, their kids are still eligible for Medicaid. And so that healthcare.gov and now the new one will be able to distinguish that and, enroll the parents in a marketplace plan, but then send the kids to, maybe possibly famous to enroll in a plan through that. So that is already available, and just want to make sure people know that.
Got it. So Deepak, if you can mute while I'm talking, that's there we go. Oh, Holly, did you have something else?
Yeah, I just wanted to, so Deepak brought up a great point, so I just wanted to add a little bit to that. So, through the unwinding, so we have been doing a lot of strategic planning around what that looks like. And so, Deepak had mentioned a special enrollment period for individuals who are impacted by the unwinding. And one of the things that the exchange is really attuned to is that even though individuals, may have, ordinarily, they might have a 60-day special enrollment period, to enroll on healthcare.gov, that, we recognize that sometimes people they might miss their notices. They just might not get them in time. They might not find their way, to the marketplace in time to enroll in coverage. And so the federal marketplace is offering, it's an unwinding SEP that started in March 31st of this year and goes through July 31st of 2024. And so as we are transitioning, we are going to continue that special enrollment period through July 31st, just like the FFM, to give people some time. So if they got their, if they were found to be redetermined in August and found ineligible, if they come in at any point before July 31st and attest to that loss of coverage, they will then have 90 days on the Virginia exchange to be able to select a health plan. So we're really working hard to try to maximize those opportunities to help people, support them, especially during this very difficult time, when it's maybe hard to find those notices and make sense of what's happening. But yes, so that's one of our key planning purposes. I also see a question in the chat, if that's okay, Natalie, about healthcare.gov sending residents to the Virginia Exchange. So just wanted to share that we have been in really, we've had extensive planning sessions with CMS around how people are going to learn about the exchange and make sure if they go to healthcare.gov that they come to the exchange, or if it's a Plan Year 23 question, that they get to healthcare.gov. And so we really have a very strategic planned process to provide consumers with that information. And yes, healthcare.gov is going to send Virginia residents to the new state-based marketplace.
Excellent, excellent. And lastly, we as stakeholders, we're gathering all this information. We're making sure that we understand how to navigate the resources that both of your organizations are providing regarding this subject. How are we informing our potential members, the public, about this tremendous change in resource that is coming to them? Is it anything that could be pointed to for stakeholders so that they can directly direct those potential and current members that may be eligible for the state-based exchange resources? Where can they go to make sure? Can you re-emphasize where they can go to make sure that those members understand what that information is? If you're going to be holding any public meetings or town halls or additional information for just members, and not members, but community members in general, what that is, and if so, how can they make sure they're accessing that information so they can further share it?
Yes, absolutely. So we are in the process of getting ready to do our brand and awareness launch, and part of that will be a tremendous amount of outreach to community stakeholders. If there is anyone that has an organization that would benefit from getting presentations and information, please feel free to reach out to us. We are working closely with Medicaid and social services to identify sort of those the specific groups that would be helpful from a training and information perspective. We will also have partner toolkits on our website and as part of our brand launch as well. So there will be much more information coming very soon. I will say that part of the as the unwinding is happening, so we are being really strategic in terms of getting that message out, because we want to make sure that people are continuing to go to healthcare.gov until we have the launch. So, but there will be much more information coming about the availability of the exchange and how to reach out to consumers very soon. So. Stay tuned for more information, but also please reach out to us and let me know if there are organizations that you think that would benefit from this information, and we will get that information out to you.
Excellent. And I think you answered a question a clarification that came up through the chat, which was just making sure that the healthcare. Oh, no. They continue to have the opportunity through the federal marketplace now. The switch will take place in November. So they're not being limited by their opportunity to access healthcare coverage. It's just that it will be a transition from federal marketplace to the state-based exchange in November. That's correct, right?
Yes,
okay.
Absolutely correct. People will still be able to get coverage for Plan Year 23.
Okay. And it's one last question. When someone loses Medicaid, does that include any capacity to look at the reason for the loss in the event that they may have been in error? And that is more of a question, not necessarily for the state-based exchange, but for the DMAS team. And we are more than happy to send you additional information. We actually have, if they've lost coverage due to an administrative reason or something like that, we definitely have avenues for which they can find out that information. So Linda, if you would like to contact us at covervirginia.dmas.virginia.gov, we're very happy to follow up with that question and make sure you have access to how we navigate through to the reason or the reason why they have lost that coverage. Hopefully that answers that question. All right. Well, we thank you both for being here, for being robust and answering all of the questions. We'll make sure that this goes back out to everyone soon. And if anybody has any additional questions, you are always welcome to submit them to Cover Virginia, or we will definitely be passing along in DPAC's and Holly's information. And I believe Holly said that it was another colleague here today, and we thank her for, the person for being here today to support. And if you have anything else, or you have any ideas about further presentations that we can provide to you as a stakeholder that will be helpful, we are open ears and we definitely want to hear from you. So please continue to give us that feedback. Thanks everybody for attending today, and have an excellent and wonderful and triumphant Thursday.